So let's cast our minds back. Spring 2020. The UK was, well, it was a nation holding its breath, wasn't it?
Absolutely. A time of huge uncertainty.
And while all the headlines, quite rightly, were celebrating our amazing doctors and nurses on the front line, there was this other battle, a hidden one, really, being fought on a completely different front.
One that most people probably never even thought about.
Exactly. But it underpinned, well, pretty much our entire response. It was all about connecting the most vulnerable people
To the labs, the places that held the answers they desperately needed.
Okay, let's unpack this, because our deep dive today, it isn't just about healthcare logistics, is it?
No, not at all.
Yeah.
It's really about that critical, almost invisible infrastructure.
The bit that connected care homes, which were, let's face it, ground zero for the virus.
Tragically, yes, they really were.
Connected them to the diagnostic labs, the ones providing those life-saving test results. It was a lifeline, wasn't it?
Yeah.
Built under just immense pressure.
It really was. And you mentioned the perfect storm in care homes. It wasn't just about how vulnerable the residents were, though that was obviously huge.
Right.
It exposed a critical blind spot, something missing in our national health strategy.
Which was?
The immediate need for a really robust, agile logistics pipeline, specifically for diagnostic samples.
Ah.
You had residents who were among the most susceptible, so that demanded rapid, reliable testing. But the testing itself, the swab, that wasn't enough.
No.
Those samples, they had to be collected, packaged correctly to stringent biosafety standards.
Right.
And then transported
Yeah.
with incredible speed
Yeah.
and safety. That logistical chain, well, it was everything.
And for a time, it just wasn't really there, or not at the scale needed.
Exactly. It was largely missing, or at least completely overwhelmed.
And stepping into that gap, that critical, urgent void, was a company called SMA Worldwide. They became this indispensable partner in healthcare logistics, providing what one source we looked at vividly described as an unglamorous but utterly essential lifeline.
That sums it up pretty well.
All through the seamless, precise transportation of specimens.
Yeah.
So let's zoom in a bit more on that perfect storm you mentioned in the care homes.
Right.
You had elderly residents, often with, multiple underlying health conditions.
Which made them uniquely vulnerable to COVID-19. Extremely so.
So detecting outbreaks really fast through testing, it wasn't just a nice to have.
Oh, no, absolutely not. It was essential for containing the spread, protecting these incredibly fragile communities, and guiding immediate appropriate care. It was life or death.
And if we connect that to the bigger picture, the public health side, any delay, any mishandling of those samples.
It had severe consequences, potentially severe. It could jeopardize individual patient outcomes, absolutely.
Yep.
It could slow down vital contact tracing.
Which was crucial for stopping wider spread.
Exactly. And significantly increase the risk of transmission, both within the care home and, beyond it. Critically, we're talking about things like maintaining RNA integrity for the PCR tests.
The polymerase chain reaction tests, right? The gold standard.
That's the one, for detecting the viral genetic material accurately. So this just created this huge urgent demand for providers who really understood the sensitivities.
Not just the technical side.
Not just the technical requirements like handling UN-373 biological substances, Category B materials, all that.
Important, but not the whole story.
No. They also needed to understand the profound responsibility, the need to act with speed and discretion during this unprecedented national emergency.
So this immense challenge growing so rapidly, it needed a partner with, what, extraordinary agility, existing infrastructure.
Precisely. And that's where SMA Worldwide, with its decades of quiet dedication to medical logistics, really came into its own.
So they had the background already.
Yes. SMA was uniquely positioned. They could leverage their extensive experience in medical and healthcare logistics, things like transporting blood banks or even organ donations sometimes. They knew this world.
So they could react fast.
Immediately.
Yeah.
They mobilized teams, resources, established dedicated routes pretty much overnight.
Wow.
This meant transporting blood samples, swabs, all the test materials from literally thousands of care facilities directly to diagnostic labs right across the country. Thousands. And just to give you a sense of the scale, at its peak, SMA was handling a volume of samples equivalent to roughly 15% of the UK's entire national daily testing capacity.
15%? That's huge. A scale almost unimaginable just months before, I guess.
Completely unimaginable.
That's an astonishing ramp up. And like you said, it wasn't just about getting samples from A to B. It was about precision, care, what did that actually look like on the ground?
Yeah.
What were the non-negotiables, especially around things like keeping samples at the right temperature?
Right. Well, for every single delivery, the SMA drivers, they operated under really stringent protocols. Biosafety Level 2, specifically.
Okay.
This meant samples were kept secure, in validated containers, and often, yes, requiring strict cold chain maintenance, usually 2 to 8 degrees Celsius.
To preserve that RNA integrity you mentioned for the PCR test.
Exactly, to make sure the tests were accurate,
Yeah.
and they had to be delivered within critical time frames, often, within 24 hours of being collected.
That's fast.
Super fast. And that rapid turnaround, it was crucial. It prevented labs from getting completely backed up.
Avoided bottlenecks.
Right.
Yeah.
And it ensured those frontline healthcare workers got timely information they needed to make, frankly, life-saving decisions.
And discretion. You mentioned that too.
Absolutely paramount.
Yeah.
Care homes, labs, they needed confidential professional handling at every single step. It reinforced trust, which was under immense strain already.
Yeah, I can imagine.
It's a delicate balance, isn't it? Because while, public data on outbreaks was crucial for the national picture, individual patient confidentiality and just the sensitive nature of an outbreak in a care home, it meant drivers couldn't just, walk in unannounced or be conspicuous. It required real sensitivity.
So their precision logistics didn't just support the operations, they actively enabled them to run smoothly.
I think that's fair to say, yes.
It really highlights how a private logistics partner could step up with a level of agility, an existing network, perhaps.
That maybe a public service might struggle to replicate quite so quickly in a crisis situation.
Exactly. Complementing the broader NHS effort, but filling that very specific urgent need. And that leads us nicely onto what we're calling the human touch, because while the world, quite rightly, focused on the incredible doctors, nurses, scientists.
Visible heroes.
Yes, the role of logistics providers like SMA, and particularly their drivers, it often went unnoticed, didn't it?
Completely. Yet their work formed the literal backbone of the testing programs, the programs that enabled the public health responses right across the UK.
What sort of challenges were these drivers actually facing day to day?
Oh, immense challenges. They were navigating really uncertain conditions, lockdowns, road closures, sometimes even flooded routes in rural areas, things like that.
Wow.
Often alone. Maintaining these strict safety protocols, which were new to everyone, working incredibly long hours, adapting constantly to rapidly changing instructions.
That sounds intense.
It was. I heard one story about a driver navigating this maze of new one-way systems in a city under full lockdown, middle of the night.
Yeah.
Finally gets to the care home, and the staff, who'd apparently been awake for something like 48 hours straight, they met him with this mix of just utter exhaustion, but also profound relief.
Because the samples were finally on their way.
Exactly. Knowing those samples represented desperate pleas for clarity, for answers.
And for many of these drivers, then, it wasn't just a job. It carried this profound sort of personal sense of purpose.
I think so, yes. They understood the importance of each sample they carried. Each little vial represented a vulnerable person, someone waiting for answers, protection, maybe treatment.
It adds that real human layer, doesn't it, to what might seem like a purely operational, almost clinical task.
It really does.
Yeah.
And despite all the risks, the restrictions, these SMA drivers, they truly became unsung heroes, right there on the front line, in their own way.
Their commitment was unwavering.
Completely. In support of public health. Their presence, just them turning up reliably, it brought reassurance to the care homes, to the labs, forging these partnerships built on, trust, professionalism, and actually genuine compassion.
Yeah. The pandemic really did underscore how interconnected healthcare truly is.
Absolutely. It's not just hospitals and clinics, is it?
No. It's this intricate, often unseen network behind the scenes, the network that keeps the entire system moving.
And SMA's role, it bridged this crucial gap, one that was maybe underappreciated before.
Definitely underappreciated, turning these complex challenges into manageable, reliable solutions.
And the lessons learned then, the systems that were built under that pressure, they continue to shape healthcare logistics today.
Still having an impact now.
Definitely. SMA Worldwide, for example, remains committed to supporting medical and laboratory transportation with that same dedication, that expertise, building on the foundations laid during the crisis.
Right.
We've seen a real acceleration, actually, in innovation. Things like cold chain technologies, real-time tracking. directly influenced by the demands of the pandemic.
And the pandemic really accelerated the need for certain qualities, didn't it? Agility, precision, reliability.
The absolute essentials in that situation.
And those are all qualities that SMA seems to continue to embody in every delivery they make, kind of demonstrating a blueprint for future resilience.
I think that's right. And if you dive deeper into their ongoing role, whether they're transporting routine blood samples from GP practices or urgent diagnostic materials for specialist clinics or highly specialized medical goods like vaccines, their service is indispensable. It ensures patient care isn't compromised. It just demonstrates that robust logistical infrastructure is actually as fundamental as the healthcare providers themselves.
So what does this all mean for us looking forward?
Well, by continuing to innovate, to invest in healthcare logistics, SMA Worldwide and, companies like them, they help build a stronger system, a more resilient system.
Ready for future challenges.
Exactly.
Yeah.
Ready to face whatever comes next with that same spirit of partnership professionalism, ensuring those critical services keep running, even when the unexpected hits hard.
Our deep dive today, it's really highlighted this unexpected, maybe but utterly vital link, logistics and healthcare, and how often the unseen parts of any system or its very backbone, quietly keeping everything from just grinding to a halt.
It really makes you think, doesn't it?
Yeah.
And perhaps this raises an important question for you listening at home.
Go on.
Beyond the obvious, what other critical, often overlooked systems or services quietly underpin your daily life?
Yeah.
Especially during times of crisis.
That's a great question.
Think about the unsung heroes in all sorts of fields, waste management, digital infrastructure, food supply chains.
Right.
The people who ensure essential services continue to function, often without us even realizing the complex dance that's required just to keep the lights on and, well, keep the world turning.
Food for thought indeed. Thank you for joining us on this deep dive into the hidden heroes of healthcare logistics.